Hey everyone, hope you guys are doing well. Hope you guys are in the best of health, and we today are going to be continuing our pathophysiology playlist, specifically acute respiratory failure. Now, before I get into this, okay, I will not be covering type 2, alright? Because this video might be long as it is, around about 10 minutes or so yeah, I'm just going to do type 1. If I have time, I'll do type 2 in the, well, before 3 days. So yeah, type 1. Now with type 1, this is all about hypoxia without hypercapnia, alright? The differentiating factors between type 1 and type 2 is the hypercapnia. They both have hypoxia, alright? Now, if we look at hypoxia without hypercapnia, which is type 1, I want you to think of a VQ mismatch, alright? Now, what is happening here? We are having a general decrease, both in V and in Q, alright? We're having a decrease in V, decrease in Q. Now, what you need to first comprehend is that what is the difference between hypoxia and non-hypoxic hypoxia? If you watched my previous video on hypoxia, it would be a lot more simpler for you to understand. However, hypoxic hypoxia is to do with basically there is a deficiency in the partial pressure of oxygen, and so this reduction is the cause of why you have hypoxia. Okay, you are breathing in a gas mixture of which has a reduction in the partial pressure of oxygen. All right, that is, well, that can consist of two factors, endogenous and exogenous. Okay, exogenous, if you watch my previous video, is split up into hypobaric hypoxic hypoxia, triple H, or normobaric hypoxic hypoxia. These are exogenous factors. Now, endogenous factors, which we will see in a minute. Restrictive disease means a disease in which you cannot intake the air. You can't get the air inside of your lungs. Okay? These are restrictive disease. You are restricting the air entering your lungs. Now, if we move on to perfusion, why is there a decrease in pulmonary perfusion? Well, think of anything that can cause a blockage or a reduction in the cardiac output, all right? Or some congenital disease, all right? So there can be a blood clot, or there can be an embolism, there can be sickle cell anemia, there can be less pulmonary vasculature. Now, diseases that can cause this is emphysema and COPD. Why is this? Because of basically there is with the damage in the alveoli, this is going to cause basically collateral damage with the pulmonary blood vessels, and so with that you're going to get a decrease in the pulmonary vasculature, and finally heart failure. All right, pretty simple. Now if we move on to restrictive lung disease, all right, these are our endogenous factors. You will see this, or you must have seen this in the colloquium. I guarantee that there will be a question on what's a restrictive lung disease. Do not mistake this for obstructive, right? Obstructive lung diseases are diseases in which you cannot get the air out. You can't get the air out of you, all right? Things like asthma, things like chronic bronchitis, things like that, all right? Now, with restricted lung disease, we can compartmentalize this into two factors. Intrapulmonary factors, which cause the restrictive lung disease, and extrapulmonary factors. Intrapulmonary is all about factors within the lung. Extrapulmonary, as you guess, factors outside the lung. All right. Hope you guys are with me. Now, with intrapulmonary factors, think like a Greek guy, right? Think like a Greek guy. Think you're smashing plates, oppa, you're gonna smash some plates, all right? Oppa, O-P-P-A. O for edema, P for pneumonia, P for pulmonectomy, A for atelectasis. All these factors are going to cause a impairment in some form or another, in some percentage. It's going to impair the intake of oxygen into the lungs, all right? And when I say edema, I'm talking about like an interstitial edema or intrapulmonary even. Intrapulmonary edema. Okay, this can be caused by cardiogenic factors or non-cardiogenic factors. All right, pneumonia. You know what pneumonia is. Pulmonectomy. Pulmonectomy is basically when you remove a lung. All right, when you remove a lung, and atelectasis is basically a complete blockage of the lung. All right. So, when you think of intrapulmonary, think like a Greek guy, all right? Think like a Greek guy. Oppa, think like a Greek guy. Extrapulmonary. Factors outside of the lung. What can this be? Number one, pleuritis, as you can see here. Right? We have a abnormal fluid buildup within the pleural cavity. There should not be really any fluid apart from the physiological amount. Okay, now you'll see this in the colloquium as well. It talks about things like chylothorax or hydrothorax, anything within the pulmonary cavity. Regard it as extrapulmonary restrictive disease. It's restrictive. It's restricting your ability to intake oxygen. Chest wall deformities. All right. These are regarded as restrictive as well. For example, two simple ones, scoliosis. So if you were looking at someone, they will have an S-shaped spinal configuration, and with kyphosis, they have like a walking stick configuration to the spine. All right. So to summarize, acute respiratory failure, two types. From this video is type 1. Think of a VQ mismatch, decrease in V, decrease in Q, and the restrictive diseases is all to do with intra and extrapulmonary factors, which restrict your ability to intake the oxygen within your lung. And these are your factors that you need to know. All right. So that is acute respiratory failure in a nutshell. Hope it made sense. And yeah, see you in the next video.